My daily lifestyle was I was pretty active in terms of working every day. In the summertime, I'd play a lot of golf. I really didn't have any restrictions, that there wasn't anything I couldn't do. The only symptom I have was once in a while I'd feel a little tired. I'd be dizzy once in a while. I had a client many years ago who had open heart surgery, and I asked him, I said, "What caused you to think you had a problem?" And he said, "Well, I was walking up the hill." And he said, "I had to stop and catch my breath. I couldn't get up the hill." So I always remembered that. And then with my 6-month checkups, that's when I became aware that I had a valve that maybe wasn't functioning the way they'd like it to.
There is a basic evaluations we have to go through every patient who might be a candidate for this procedure. Based on the results, then we'll decide, and as the heart team or the TAVR team, we sit together in a weekly basis, and then we'll review those patients and their workup that is already done. And then we'll decide, is the patient gonna be candidate for the TAVR, or he can be a candidate for the surgical aortic valve replacement. Most of them, clearly they want something that is faster, quick recovery, so that's why they go for the TAVR.
They have a pretty good sense of what's inside of me, much better than I do. And when they say, "Hey, you are a candidate now," I said, "Yeah, let's go ahead."
Transcatheter aortic valve replacement is non-invasive procedure to implant valves in the heart. Roughly 10 years ago, the whole process began. And initially, it was pretty much isolated to tertiary care centers so that the technique was perfected. Now, the TAVR valves are implanted and they go home the next day. I would say 80% of the valves in the country being implanted by TAVR valves rather than open valves.
In Dubuque, we're already done more than 250 cases since 2019. And this is a big number for a small town like this. We were very happy and we're very satisfied with our outcomes.
We had the procedure on a Tuesday, and on Monday I was playing 18 holes of golf. I did feel a better sense of energy, but the psychological relief was 100%. I mean, all of a sudden you're not worrying about, hey, I could fall over any minute. My dad died at 73. I had this procedure at 73, and he died from heart failure.
A lot of patients will confuse their symptoms of shortness of breath and fatigue as normal signs of aging. And so when they come back at their 1 month and their 1 year and they say how much activity they're able to do, they're just shocked by it because they thought it was just because they were 80 years old that they were slowing down. So it's always rewarding to hear that they are feeling better and able to do more with their grandkids or go out on activities.
You can enjoy the other things in life a lot better when you're not thinking about your heart. This procedure gives you relief. I would recommend it to anybody that qualifies for it, and the fact that you can do it in your hometown is a bonus. I know I'm in good hands because I know them professionally and then I know them personally, and that's a big deal to me.
We're connected to our patients in more than just a patient-provider relationship. We're part of this community. It's one thing I'm most proud of.
If you have a valve problem, it can be fixed, and if you can fix it with the TAVR as opposed to open heart, it's a miracle type procedure.